Hi, everyone. Welcome to week 3 of Walk with Ease. I hope that your walking sessions are going well. If you are having any barriers, if you're encountering any barriers or problems, or if you're having some successes, I hope you'll take time to discuss that with your group today. But I will go ahead and get us started on today's lesson. We are going to be talking about how hurt doesn't equal harm. But if you are experiencing some pain, some things to consider are you wearing supportive shoes and comfortable socks? Were you walking on a level surface or using good body mechanics? Were you using techniques for coping with pain and discomfort? Maybe you should walk more slowly or cut back on your physical activity until you find a level that doesn't cause you more pain. So just some things to consider if you are, for some reason, experiencing some pain. So today we're going to be talking about different forms of arthritis. Arthritis means inflammation of the joints, but that's misleading because some forms do not involve inflammation. 52.5 million Americans have been diagnosed with arthritis, and by the year 2030, that number is projected to be 67 million. There are many causes for arthritis, but there are two specific factors that increase your chances of getting it, and those are being overweight and having an injury. While the term arthritis is used for over 100 medical conditions, the three most common conditions are osteoarthritis, rheumatoid arthritis, and fibromyalgia. Osteoarthritis is the most common form of arthritis and now affects nearly 27 million Americans. It is sometimes known as degenerative joint disease. It commonly affects the knees, hips, fingers, neck, and lower back. The severity of osteoarthritis varies from person to person. The majority of people with this type will not experience severe disability or joint disformity. Most can manage by using a variety of strategies like medicine, pain management techniques, or joint replacement. We now know that cartilage needs joint motion to stay healthy. The motion of exercise both delivers nourishment to the joints and gets rid of waste products. Without motion, this vital exchange cannot take place. Joint cartilage actually deteriorates if a joint is not moved regularly. So you can see on the screen, we do want to move those joints regularly if we have osteoarthritis. Moderate activity is best, so we wouldn't want to do a lot of vigorous activity. We want to find a balance between getting enough exercise, but also getting enough rest, and good shoes and posture are important. Doing strength training exercises helps because, and we're going to talk about this more later, but if we have strong muscles, our muscles can support those joints. And we know that extra weight does speed up damage to our joints. And so that can be a concern as well. Moving on to rheumatoid arthritis. Rheumatoid arthritis is a systemic autoimmune disease, meaning that it's a disease that can affect your whole body because the person's immune system attacks the body's own tissue, causing inflammation of the lining of the joints and other internal organs. About 1.3 million Americans have this form. Along with joint issues, it can cause fatigue, decreased appetite, and weight loss. There's no cure for this condition, and the exact cause is unknown. When a joint is hot, painful, and swollen, rest helps reduce inflammation, which is good, but with too much rest, muscles lose strength. Ligaments and tendons become less strong, and bones become softer. When in doubt, consult your physician, rest as needed during flares, and try to continue very gentle movements like aquatic exercise would be a good one if you have access to a pool. Low impact exercises are a good idea. Flexibility and strengthening exercises are important for, again, supporting those joints and maintaining a range of motion. Good posture and joint motion during exercise can help ease pain and tightness, and movement helps prevent the loss of mobility. And then we have fibromyalgia. Fibromyalgia affects around 2% of the US population. The name means pain in the muscles and fibrous connective tissues. It's not actually a joint condition, but a syndrome with a set of signs and symptoms that include moderate to severe fatigue and lack of energy, decreased exercise endurance, sleep disturbances, headaches, widespread muscle aches, and tender points in the body. Other symptoms include tingling of the face or extremities, abdominal pain or bloating, alternating constipation and diarrhea, urinary urgency, and skin sensitivity. Some degree of pain is always present. Recent research has shown that individualized exercise at the appropriate intensity, whether that be low or moderate, is a very important part of treatment. Okay, so regular exercise programs should include 3 types of exercise, and those are flexibility, strength, and cardiovascular. And we're going to kind of talk about each of these now. So flexibility means being able to move your joints through their fullest degrees of motion, called range of motion. Flexibility or stretching exercises are important because losing range of motion can reduce your ability to do the basic everyday activities of daily living, like being able to reach up high and get something out of a high cabinet, or reach down low to pick something up off of the floor. Important tips for flexibility exercises are to complete 10 to 15 minutes of gentle, smooth stretches a day. Flexibility exercises are important to do before and after exercise, just like we do before and after our walking in this program. If you've been inactive for a while, stretches are a really good place to start to kind of work your way back into being more active and doing exercise. So it's a good starting place if you're just kind of getting back into that. Moving on to strength training. Strengthening exercises are important for lessening the stress on our joints. Muscles help absorb shock and protect our joints from injury. Therefore, stronger muscles help absorb that shock, just from our daily movements, the shock that occurs to our body. It absorbs that, so it protects those joints. And it helps us to maintain functional strength necessary to perform everyday tasks like climbing stairs or gardening, picking up groceries and bringing them in and putting them away. All of those things, strength training is important to help us be able to continue to do those things. The national guidelines recommend that you do strengthening exercises on at least 2 days a week and not on consecutive days. So we want to kind of have a day in between each or more, but each of our sessions to rest, let our muscles recoup and grow stronger and recover. So you can do other forms of exercise on those days off, like you could go for a walk on the day in between, but we want to kind of space out those strength training sessions. We just remember that we want to start slowly, start where we are, ease into it, and we can build up gradually. It's a lot safer to take that route and then just jumping in and going crazy and then being in a lot of pain. So then the final type of exercise we're going to talk about is cardiovascular. And contrary to what some people may think, it's just as beneficial to do moderate intensity exercise as it is to do vigorous. The health benefits are the same. And for a lot of people, vigorous activity is just not realistic. It's not going to be enjoyable or sustainable. So staying at that moderate level is really what we recommend, particularly if you do have arthritis or other chronic conditions. Cardiovascular exercise, also called aerobic or endurance, it makes our heart, lungs, blood vessels, all of those things work better and are stronger, and these exercises help to improve stamina, strengthen bones, improve sleep, control weight, reduce stress, depression, and anxiety, relieve pain and stiffness, and release those feel-good endorphins. So something that's important, anytime we are we've set a goal for ourselves and we're trying to achieve something, a healthier lifestyle, we're going to experience greater success if we keep our walking plan and we include the support of those around us. So we include our family or our friends or our colleagues as part of that support system. It provides us with some accountability, right? Because if our friends kind of know that we're trying to get into this habit of walking or we're trying to eat healthier, it's going to hold us a little bit more accountable to that goal. So I do encourage you to include, and maybe it's just one person, it could be your spouse, or it could be someone that you go to church with, or someone that's in this program, but finding someone to kind of help be your support system, and you can be a part of theirs as well. Because our chances of success are actually greater with a strong support system. So that completes our lesson for today. We're going to get into that 5-step basic walking pattern. So I'll let you go ahead and complete your warm up, and then we'll be back here to do our stretches.